Now today we see a very interesting uh, comparison between ischemic stroke and hemorrhagic stroke. Now when we can see these are the two city brains, and what we can see very clearly is on this right side, this is the CT scan of the brain where we can see a very hyper dense and a white structure which is very well visible here. So we know that on CT scan of the brain, the most hyperdense or dense white structure, those are either bone, blood, calcium, or a contrast. So we know that this is all bone, this is all bone, and this is actually a calcification. That is a normal calcification. This is ventricular system where we have a normal calcification in the ventricles. It is pretty normal structure, and this ventricular calcification will be seen in both the brain field. So this is typical ventricle. These are ventricles, and here a dense white structure is a calcification. So here this is the bone. This calcium calcification means itself is a calcium, and contrast, this is a plain brain city. So here there is no contrast. So on this portion is left, this portion is right, and it is always like that. Here it is mentioned it is right and left. This left means this side, this right means this side. So whenever we are about to localize the lesion, the most important structures which we can see is these are the two lateral ventricle, this one and this one, and just beside this small almond like structure is caudate lobe. This is caudate lobe. So this will be seen here as well, that this is a caudate lobe. The other structures which we, if we want to see, if you want to notice, is this is the caudate. So exact opposite to this caudate, here you will have a thalamus. So this is the thalamus, this is the caudate, and the third structure which is seen here, we can see in this image, what we can see is this is the caudate. This structure is the thalamus, exactly opposite, exactly backside of this. Here we have a caudate lobe. Caudate means triangular shape or lens shape, and in between these three structures we have an internal capsule, because this is inside. Here we have an external capsule, this is an internal capsule. So this is the caudate, this is lentiform nucleus which is putamen, and this is thalamus. Now you have to remember one mnemonic, that is PTPC. The most common hypertensive bleed occurs at putamen, followed by thalamus, followed by pons, followed by cerebellum. Now, how to identify the brainstem structure is very easy. So here we can see the perfect round structure is pons. So what we can see here, this dot is the basilar artery. This is the basilar artery which forms by joining the two vertebral arteries. You can simply see that again. See, this dense white structure is basilar artery, and this is just in front of this pons. So pons is perfectly circular structure to understand. So this is the cerebellum, this is the cerebellum, this posterior fossa structure, this is the pons, and above the pons a butterfly shaped structure is midbrain, which you can be which can see which you can see here. So this is the butterfly, these are the wings of butterfly. So you can trace it here. So this is a butterfly structure, this is some portion of butterfly, and then this is pons, this is pons, this is pons, and this, below this there is a continuation into spinal cord. This is foramina magnum, and beyond this foramina magnum, this round structure is medulla. So this is medulla. So this is medulla. These are all brainstem structures. So We have identified the most important structure. This is putamen, caudate lobe, thalamus, and brainstem structure. So this is a very typical of right-sided putamenal bleed. This is very typical right-sided putamenal bleed with so much of edema. Now, how to come to know the edema? The edema will appear dense black or radiolucent. Just compare these two. This is left side of the brain, and see how much sharp this edema is there. So this is all edema around the bleed, which is not there on the left side. We can see here also. This is very sharply demarcated edema. So this is all the edema which is around this bleed. Just compare these two brain fields. This is the right, this is the left. See, this is so much dense black appearance around the bleed. This is typical of edema. See, here also we can very easily see. So this patient has right-sided putaminal bleed which appears hyperdense. On the other hand, this patient, if we can see, is having radiolucent shadow. Or here, there is a dense black lesion around this area, which can be very well localizable. You can see here, which you can see here also, here also, here also, here also, here also. So this is the right side of the brain which appears much radiolucent on this right side. This is a very typical sign of an infarct, and it is very easy to understand. We have three main arteries, that is anterior cerebral artery, middle cerebral artery, and posterior cerebral arteries. It's very easy to understand. Just have these lateral ventricles, just as these lateral ventricles. These are the two lateral ventricles. So this lateral ventricle, this area is all of middle cerebral artery. This front area is of all anterior cerebral artery, and this posterior aspect is all of posterior cerebral artery. So this is very easy. This is a very typical of right middle cerebral artery infarct. In posterior cerebral artery, very commonly we get all this posterior aspect of the brain which are involved. So you will get the pontine lesions, midbrain lesion, thalamus lesions, cerebellum lesion, and obviously the occipital region. So this is a very nice comparative of different strokes, that is ischemic stroke and hemorrhagic strokes. So for now, this is for all, and thank you so much.